Welcome everyone to NCUI's fifth and final Project Firstline Echo session for the grant year with our UIO IPC System Champions. Our topic today is a full circle approach in infection prevention work at all of our UIOs. A recap of the gap analysis, competency, operational processes and procedures, the accreditation, systematic approaches, and infection prevention control. We are pleased that you could join us today. It is our hope that this forum provides an opportunity for you to lean on each other for support and guidance while fostering best practices as we develop a community of learning through our ECHO program. Today, we will hear from our experts in their fields as well as offer opportunities to all participants to weigh in on the lecture discussion and case presentation. First, before we begin, just a few housekeeping items. If you have video capability, please enable it. It helps us to make for a more interactive and engaging session if we can all see each other. And please also make sure that your microphones are muted during the session. We will have the ability to mute and unmute yourself to participate in today's call. And also please ensure that patient privacy is protected and do not provide any PHI during today's call or any of the ECHO sessions. If you do at any time have any IT difficulties, please use the chat box feature to chat directly with Tiffany Stark and she can assist you. Finally, if you could just enter your name and your UIO or where you are from into the chat box and we can track your attendance. Next, as you can see, our agenda is going to follow as our normal, the traditional ECHO anatomy, where we're going to begin with our introductions, go into our lecture, our case discussion, and then our closing. We would like to thank the Centers for Disease Control and Prevention for their support throughout Project Firstline. Project Firstline is a national collaborative led by the CDC to provide infection control training and education to frontline healthcare workers and public health personnel. NCUI is proud to partner with Project Firstline. CDC is an agency within the Department of Health and Human Services. The contents of this program do not necessarily represent the policies of the IIIHC accreditation body, OSHA, CDC, or HHS, and should not be considered an endorsement by the federal government. Next, we would like to acknowledge our Project Firstline staff at NCUI. This team, along with all of you, is who has helped to shape the ECHO into what it is today. And my name is Melissa Watson, and I'm the Public Health Project Assistant. Next, I would like to introduce our trainer for today, Evelina Majo. She has a wealth of experience working with American Indian, Alaska Native populations in the healthcare arena, and she also holds a master's degree in administration. We would also like to welcome our subject matter expert, Dr. Abigail Carlson, an infectious disease doctor from the Centers for Disease Control and Prevention. Dr. Carlson serves as a subject matter advisor on healthcare epidemiology and infection control for CDC's Project Firstline. And we will also have Karen Kwok with us, our subject matter expert here at NCUI. Karen is a family nurse practitioner who has experience not only in direct patient care, but in operations and workflows of infection prevention and control. Our team will use the CDC developed tools along with resources to support our ECHO program and case discussions that you submit within the scope of Project Firstline training initiatives. This ECHO platform creates a community of learning to foster and share best practices. It provides us with the ability to implement ideas into different service areas, as well as provide support and mentorship during the COVID-19 pandemic. Before we begin our lecture, we would like to note that the session is recorded for educational and quality improvement purposes. If you have specific concerns regarding this, please reach out to Tiffany in the chat privately. By participating in the call today, you are consenting to the recording. Slides from today's call with a video recording of only the lecture will also be shared following. This is to ensure confidentiality and provide a safe space for us to discuss concerns and ask questions. Also, please remember to complete our post-session evaluation survey, which we will share in the chat box, and we will also be emailing as well. Next, I would like to move into the lecture. So Evie, I will now hand over to you.
Thank you, Melissa. I have no relevant financial relationships with the manufacturers of any commercial products and are a provider of commercial services discussed in this activity today. And I also don't intend to discuss an unimproved investigative use of commercial product devices in our presentation as well. And today, we hope, next slide please, we hope to based on our overview, formulate IPC program action plans and findings through and from our gap assessments, review, leverage, and leverage strengths with our IPC opportunities from a SWOT analysis. Also, utilize and recognize the importance of QI tools to plan implementation and evaluate processes of IPC programs. And again, apply IPC principles into your individual project Firstline proposals. And at the very end, I track IPC gains, achievements around staff competency, operations, protocols, QI accreditation efforts. Next slide. This slide really just gives you an overview of all the important IPC lessons and topics we covered, ranging from the implementation of an infection prevention control program to applying the IPC to your individual IPC projects, assessing our knowledge around staff competency, skills, and healthcare infection prevention control program, and then utilizing and the risk management programming and overview and how to bridge that staff operations policy making activities into an infection prevention control. Next slide. So this next slide really gives you a snapshot of the different, I think it's slow on my end, but you should see the project, the champion project summary slide. It provides you an opportunity to quickly just view some of the projects that our champion UIOs have submitted. And each of the UIO, of course, they're all different. We have a residential outpatient treatment center, a limited ambulatory outreach referral, one entity organization that primarily does only outreach and referral, full ambulatory as well. So there's, again, array of different types of UIOs down throughout the country that have participated in this particular project. And we've been able to have engageful and meaningful conversations around the different projects proposed. Next slide. So one of the things that we plan to do in this particular session today is to approach our community of learning through a systematic approach. And with this final echo, we revisit the initial gap assessment and of IPC program needs. We want to come full circle, and we will have a recap of the core IPC components or concepts, QI tools, and also risk management plan with the IPC program implementation. Next slide. So when we're talking about the implementation or a full completion of a system through a systematic approach, the IPC workplace encompasses the safety program and patient safety benefits. And when we actually do that, we arrive with benefits, and these benefits may include prevention of workplace injuries and illnesses, improved compliance with laws and regulations. It helps to reduce costs, including significant reductions in worker compensation premiums, and also finally increase productivity and enhance the overall business operations. Next slide. At the beginning of this project, champions completed a gap assessment to determine gaps in their individual IPC programs and to identify targets for training opportunities. From strengths noted on the gap assessment, the UIOs can then build upon their already existing IPC infrastructures to ensure successful implementation and sustainability of their IPC project and IPC QI initiatives. So, next slide. I wanted to briefly pause here and review this slide. Upon submission of the gap assessments from our UIOs, these were the top areas of opportunities for improvement that were noted. And one of them is auditing. 2, competency assessments. Number 3, equipment policies. Number 4, training. And then 5, trained IPC staff. And so if you could take a look at that, there's different domains, there's different areas within that gap assessment that each of our UIOs had an opportunity to review and evaluate within their respective IPC programs. Next slide. So what came from that gap assessment, in addition to this previous slides, are that all, so these were the main, I guess, domains that came out of that, and were also brought through and discussed through case submission forms and to address some of the deficiencies identified. They include infection safety, respiratory hygiene, point of care testing, device reprocessing, healthcare personnel safety. Next slide. We also wanted to talk a little bit about the SWOT analysis. From the target areas identified in the gap assessment, the SWOT analysis can help the UIO or you to categorize the entire context of the UIO operations, staffing, and the IPC opportunities. There are also many yeses responses for the IPC policy component, the procedures in place. And building on these strengths, you can leverage capabilities to address outdated or limited protocols. Also, the community of learning with other champions and other UIOs utilize these ECHO opportunities for adapting other UIO best practices to address staff clearance challenges with outdated vaccines and immunity non-compliance types of findings, with integrating opportunities such as Project Firstline IPC project successes. It is hoped that the CDC training videos, the competency assessment checklists, the clinic signages, and maybe QI tools help really to improve the UIO's capacity and demand. Okay, so this is just a quick snapshot of some of the strengths that were identified, some of the weaknesses, opportunities, and the threats that might pose from an organizational, internal infrastructure standpoint. So some great information here that we were able to collectively gather and summarize. Next slide. So from the gap assessment, some of the common no's that we received were really around safe injection practices, the protocol, and that there needed to be an emphasis around new procedures, making sure that there's demonstration of competencies with routine audits, and also the annual, and revolving competency training plan that would include new equipment and its use, its proper usage, and maintenance, and all of that whole piece that comes together. Next slide. So we're talking about safe injection protocols. We want to make sure we, as managers, as leadership within our UIO, that we take these things into consideration, that we educate our team, we understand what are the risks in our organization and how we do the work that we do. Is our staff competent? Do they understand, comprehend? Are they able to practice within the clinical standards and expectations, and do the job they need to do? And then realizing what is at stake. So this is just a quick snapshot and a reminder that we as managers have to take an active role in this as well when it comes to safe injection practices and multi-dose vials. Next slide. As we continue on around this particular findings and the common no's as it relates to safe injections and multi-dose vials, we also wanted to just summarize some of the key points and topics that we covered previously, and additional resources. And some of these resources actually have been provided to you already. I just want to remind folks that this PowerPoint will be made available to you in your organization. So when you go back and reflect back on those gap assessments, you'll be able to pull up resources and tools and sources that can create that opportunity to check off that no and make it, yes, we're actually doing it here at our facility. Next slide. On this slide, we want to make sure that we're following safety guidelines from CDC, and there's a nice guideline for you as well to make sure that we're following the proper infection control practices. And, you know, for example, aseptic techniques during preparation, administration of injected medication, never administering medications from the same syringe to more than one patient, even if the needle is changed. So these are just some highlights, and wanted to share this with you as well. Next slide. When it comes to operations, also, we have to be reminded, and as leadership, as managers, floor leads, our clinic floors, and even in our public health setting, that there are certain standards that we have to abide by when it comes to operations. Making sure that our immunization documentations are in place. And on this slide, again, as we previously reviewed in some of our previous ECHO sessions, these are some resources that your team can also reflect back on. Next slide. With this particular slide, this really just showcases the common no's that we receive around patient education, handouts, respiratory hygiene cost policies, isolation protocols, also the healthcare personnel IPC training, policies and procedures around respiratory pathogens across all types of services provided as well. So these are just some of the common responses that we receive in this particular domain as it related to respiratory hygiene and cough etiquette. Next slide. And as a reminder for all of our participating champion sites, we did cover all the different areas. We provided training video. There is a competency assessment, clinic signage around this particular topic or domain area. Some guidelines also here available for your UIO to utilize as a resource. Next slide. As a reminder, each of these, of course, are requiring, you know, training at new employee time or annual training, and periodic training is recommended for all staff. And of course, we talked and we dove into each particular staff, their title, their work, what it entitles, and what it encompasses, and the requirements around that. So, of course, as a leader, you would make sure these things are also just as important. On this particular slide, it really talks about operations activities, again, around respiratory hygiene and cough etiquette. Making sure that we have the visual aids in front of us and the proper resources for our, you know, work around protecting not only our staff but our patients as well. Next slide. On this particular slide, again, we previously covered a huge, both in our live training webinars and some of our ECHO sessions around optimizing the use of engineering controls to reduce and eliminate exposures by shielding our healthcare team, our healthcare personnel, and the patients that come and visit our sites as well. And these are just some of the key components that are important and relevant, and we wanted to share with your you all again. Next slide. When the gap assessments were completed by our UIOs, and we summarized some of the findings when those assessments indicated no, some of the common things that were returned were medical and dental, working through, for example, the dental POC plan. Another indicated that the healthcare personnel required to demonstrate competency. Facility routine audits. So all of these listed here are just some of the examples that our UIOs are currently working on or have tackled or are currently in the process of making sure that they meet some of the minimum standards indicated and are assessed through this gap assessment. And so the next few set of slides will be talking to the point of care testing materials. So next slide, please. So we wanted to just remind folks that the point of care tests are diagnostic tests performed at or near the place where a specimen is collected, and they provide results within minutes rather than hours. And so they may be molecular, antigen, or antibody tests. And CDC recommends the following practices. And so you'll see an image to your right on the screen. This is just a quick point of care testing procedures or recommendations that we wanted to share with you. Again, at the end of this talk, in addition to the slides, you'll also see, you'll be provided these recommendations following this talk through a PDF document. Next slide. We also wanted to emphasize again that as with our previous ECHO sessions and training opportunities, these are some highlights around the importance of cleaning and disinfection for personnel collecting specimens or working within 6 feet of patients suspected to be infected of SARS-CoV-2. Making sure that our personnel, our staff is handling the specimens correctly and collecting those. Also, additional general information about proper collection of handling of each of the specimens and the types. Okay. We talked a lot about also disinfection of surfaces, and some of those recommendations are listed here for you all again. Next slide. We also wanted to make sure that, as a reminder from our previous UIO ECHO sessions and training opportunities, these are, this slide just highlights some of the general guidance around laboratories and how they should perform a site-specific and activity-specific risk assessment also. And within those risk assessment and mitigation measures, they're really dependent on what procedures are performed, identifications of the hazards involved in the process and the procedures, the competency level of the staff, the laboratory equipment and the facility, and the resources that might be available to you. Also, we dove into the laboratory waste management component, what the waste is generated from the lab section, and how they might be discarded as a biohazard waste. All waste disposals must comply with your local, regional, state, national, and international regulations as well. We did also cover in previous ECHO and training sessions on environmental protection, EPA regulations, and state universal waste programs. Next slide. We also talked, and if you reflect back on some of our training in our ECHO sessions, we did talk about disinfection and sterilization as well, and how they're categorized as non-critical, critical, or semi-critical. Next slide. So again, a summary of semi-criticals. I'm not going to dive into lecturing what all of these different components are, but we wanted to share it through our ECHO again as a reminder, all the different categories, how they are categorized by risk category, okay, and some of the prevention activities around that. Next slide. So according to our gap assessments and when the point of care testing components were kind of the common theme and how our UIOs needed to address some of this, the different elements within this domain, we recommended some training videos, and this is made available for you here on the slide. There's a training video on there. There's also some competency assessments that you may utilize on your for your UIO specifically. Next slide. Again, operational wise, on making sure that we support what is written in policy, procedures, and in practice for our staff. And environmentally, we also need to be cognizant of what is made available to help reinforce some of the things that were pushed at the clinic level, and that's through clinic signage. Also making sure that we're abiding by some of the clinical guidelines, and on this slide, we've made that resource available for you and your team. Next slide. Around point of care testing. We also were able to summarize all the no's that we received through this gap assessment as well. And for this particular domain, really emphasize or focus on device reprocessing. So on your slide, under the points there, these are just to summarize different elements of what our UIOs had reported. That, for example, the policies and procedures around routine audits, written feedback, enhancements of risk assessments and responses, for example, were some of the common things that were reported as no. Midway through here, it indicates, for example, the need for a policy and procedure to ensure reusable medical devices are clean and processed appropriately. So I won't read through the whole slide, but these are just some of the common things that were reported through the gap assessment. Next slide. So for the single-use devices, because we got a numerous amounts of responses around that, we wanted to make sure that we also provided you additional resources that we previously provided, and then we also added a few things here. But there is also a training video on this topic around single-use devices, and also a competency assessment for your teams as well. Next slide. So again, back to processing and single-use devices. There's a figure or a picture on your left about a quick self-assessment tools that would help you and your team to help you assess where you might stand. In addition to that, we've also provided some guidelines and regulations around reprocessing of single-use devices. Again, the guideline for disinfection, sterilization in healthcare facilities is also available in PDF for you. Next slide. So one of the things that we wanted to make sure that we talk about today, and the importance of us going through the risk assessment, is that it really poses an opportunity for our team to assess where deficiencies may exist. What are some things that are happening and occurring where the UIO is in compliance with some of the basic requirements around IPC programs. And with a full systematic approach in IPC, we want to make sure that we're covering everything from healthcare personnel safety, and all of those different components listed within that, the infection control breaches, looking at the opportunity for improvement in some of the broad areas that we covered. Some important elements also to consider and to make sure that we review and are observant around antibiotic stewardship as well. Next slide. Again, these are all some resources and tools. So training videos available to you and your team, sample competency assessments around this, clinic signages. And again, this is just really to reinforce healthcare personnel, workplace, and patient safety as well. And so when we're talking about a systematic approach, we're pretty comprehensive in our approach and making sure that we cover all of those different domains that we covered. Next slide. When we're talking about operation activities through, again, IPC systematic approach, the operational activities that we encourage, again, are promoting safety awareness, facilitate prompt reporting, post-exposures of management of injuries, identifying unsafe work practices and devices, coordinate selection of evaluation of safety or like dental devices, organizing staff education training, complete the necessary reporting and documentation, and monitor performance. And I think in addition to this, we also talked a little bit and highlighted what Indian Health Services, for those of you that are funded by IHS, there's this whole movement and work towards a safe, sound working environment where employees feel safe to report, that there's a reporting internal mechanism and process in place, and that employees are not feeling like they feel safe to report, and they're adding to improvement measures in a lot of different ways. So we want to make sure that we have a just safe culture type of environment. And again, there's some recommendations on this slide for you as far as clinical guidelines. There's also a facilities risk management IPC activities checklist that we found for you, and you're welcome to visit that document to help support the work you're currently doing. Next slide. I want to make sure that we also move into the important topic around risk management. IPC is a component of it, or we want to make sure that we talk a little bit about this process and how it adds into the work that we do. So making sure that we identify the hazards and risks, we evaluate those risks, we determine what controls may currently exist and how we might maybe come up with new ways to control also, and then implement these. And then we go back and we review and make sure that we're in compliance. We're making sure that there's sustainable efforts around it and what that might look like. In addition to that, making sure that we're working in accordance to current guidelines and recommendations as well. So on this slide, you should be able, once you receive the slide deck, you'll be able to click on each of the different steps and pull down the resources you need to utilize with your teams as well. Next slide. With our risk management operations activities, the gap assessment also revealed that there might be some concerns around the OSHA bloodborne pathogen training, the lack of it, or in some cases, it may not be comprehensive as initially thought. And so revisiting that particular topic, for example, and utilizing the risk management process to go through and identify, again, the hazards, the risk around that particular area and domain, evaluating what the risks might be, implementing a risk mitigation plan, and then going back and reevaluating that effectiveness and the control is really important to do. Next slide. It's also very important that education and training, employee orientation, ongoing in-service, annual review, competency validation, and event-specific trainings are also held on a continuous basis. Health clearances, also pre-employment requirements, making sure that not only are we instituting what those standards of practices around, for example, PPE, which is our high concentration early on, hand hygiene, donning and doffing, but not only do they understand it, they actually practice it, initiate it, and do it, but it becomes a part of their cultural norm. It's something they naturally become to do. That's really what our desire is when it comes to standards of practice. And so it becomes a culture of safety for our staff as well, and outcomes with staff standards of practice as well. And again, on this slide, there's a source and additional resources for you at the end. There, next slide. We did talk a little bit about laboratory improvement amendments in statutes, and this slide provides you some of that, the information we covered early on through ECHO and some of our live training as well. Next slide. It's important to just making sure that we are able to abide by some of those and make those into practice at our clinic area. I'd like to pause here now, and I'd like to hand over the presentation to Zephora Fuller to discuss accreditation efforts and some of the work that this might lend to into that overall theme of things. I also want to invite our SMEs to add additional comments after Zephora is done with her section.
Absolutely. Thank you, Evie. A great CDC disclaimer on the competency tool does state that although some of the recommendations in the self-assessment checklist exceed clear requirements for wave testing, following these good testing practices will likely lead to reliable, high-quality test results and will enhance patient safety. And so that's a very important statement, as it allows for a more comprehensive approach to standards of practice. In the AAHC's Chapter 5, Quality Management and Improvement, Subchapter 1, Standard E, they set the stage for standards of care. And so they focus on evidence-based clinical practice guidelines, ongoing performance improvement strategies, and an organizational infrastructure that emphasizes high-quality healthcare. So to achieve the high-quality healthcare operations, the AAHC lays out their effective 10-step QI approach within their Developing Meaningful Quality Improvement Studies tool section. So you can find that at the back of version 41's handbook. They also require continuous operations activities on 5 key medical dental home metrics, which encompasses the patient-provider relationship, accessibility of care, comprehensiveness of care, continuity of care, and quality of care. In addition, Chapter 5, Subchapter 2 outlines required risk management program elements. And so those elements include specific policies that your organization should include on risk management, patient safety, incident reporting, and adverse incident reporting, as well as any corrective action approaches that ensure your organizations are effective and efficient in their clinical practice. Thank you, Evie.
Thanks, Zep. I thank you very much for adding that component and recommendation as well. Thank you. This slide really is just a tabulation of what the trends are, and we also wanted to make sure that we highlight some positive aspects of what we were reported on the gap assessments from each of the UIOs. This is a quick overview of opportunities for improvement and what this trend looks like, or what this movement is with this particular group, is being able to do that critical self-reflection through the gap analysis, and looking at the different domains within that gap analysis and creating an opportunity to either create or enhance existing efforts with your respective UIOs. So I will go ahead and pause here. Could we go into the next slide and we can dive right into questions? I'd like the SMEs, Karen, to open up her mic. Before we do that, let me have, I'm going to allow Dr. Carlson to add to our lecture or our overview today, and then we'll allow Karen also to do the same. And then I already see a question in the chat box, and Johnny will get to your question as soon as we get through our commentary. Thank you.
Thanks, Effie. It's been a wonderful presentation to listen through and just kind of get a comprehensive view of what all has been done over the last half of a year and more. I had a few comments to build on themes that came out of this. One of the things I think that infection prevention in general struggles with is that sometimes it can seem like this huge realm of policies and regulations and measures that we have to follow, and getting everything in line can be extremely daunting. And you guys have gone a long way to get tools and processes in place over the last year and a half to make progress. But I just wanted to kind of step back for a moment and think a little bit about what all of that translates into, you know, from a on the ground perspective. When I'm looking at my policies and I'm looking at my guidelines, I like to think of it as the description of what I want to put in place. It's not the thing itself, but rather my sort of ideal situation for what needs to be done. And then I think about infection prevention as a three-part process. The most important part is actually the actions. It has nothing to do with the systems or processes for the moment, but rather the things that every day on the front lines people do. So whether that's cleaning your hands, putting on PPE, maintaining good, clean and dirty areas, doing device reprocessing appropriately, managing needle sticks appropriately, all of those are behaviors, they're things that people have to do. And all of that needs to be supported by systems and by culture. And the systems part is really what policy is describing and what guidelines and requirements are getting at. It's the systems that support people to take the right actions when they need to prevent infections from spreading. And so that's why this systematic approach and the systems emphasis is so important. And I like to put it in the context of a code blue, right? If you're calling a code, somebody's got to go and do the CPR, and that's what really matters for the patient. But if there's no phone number that you can call to call a code, if there's no code team organized to run a code, then the whole code falls apart. Nobody can do the actions because the system isn't set up to help them do the code. So that's why systems get so emphasized and are so important. And so the systems building is really all these systems to put in place to support the actions at the front line. And then encompassing all of that is culture. And culture can be a lot of things. Some of it is very institutional. Some of it is an institutional culture, like Evie mentioned, of being able to speak up, being able to say this is, you know, a risky procedure, or I'm concerned about this process, or we need to stop because I think that there's a risk here of infection. Some of it speaks to larger cultural values. So institutions like, say, the Mayo Clinic has a very specific cultural value. The needs of the patient come first. And that is their cultural value that they've been able to integrate across their systems and across their actions. And some of it goes beyond the institution. So for example, in Thailand, it's very common for infection control measures to include taking off your shoes. because there's a strong belief in Thai culture that feet are dirty and shoes are dirty. And so if you're going to do anything quote unquote clean, you need to do it with new shoes on. So they actually have isolation shoes, which is not a thing we have in the United States. You can incorporate some elements of culture, like in Minnesota, sometimes people will, where I'm from, people will connect infection prevention efforts with concepts of Minnesota nice, and how the people who see themselves as part of this greater culture of Minnesota nice, you know, are protecting each other and caring for each other in this way. Infection preventions are one way of doing that. So thinking of many ways that you can link the shared culture of patients and staff, but also build your own institutional culture, build your own safety culture to bring about these actions and to support these systems. So that's the first thing I will say. And then the second thing I wanted to bring up is that sometimes it can be really overwhelming when you list out the number of things you'd like to correct or change, right? You have this huge list of things that all of them seem important, all of them seem significant. Some of them are going to be mandatory. They're either, you know, life and death in a really direct and immediate way, or somebody has said, you must change this, you must correct this. And those things are your priorities because they have to be. But then there's all these other projects and you're trying to figure out, how do I choose what to do first? And I like to give people a very basic framework. And it's called an impact effort matrix. I did not come up with this. It's a very common thing. But the impact effort matrix helps you really quickly think through what's easiest to do. And you measure things on two scales. One is the impact it's going to have on preventing infections. Is the thing that you want to tackle, is it going to have a low impact? It's not going to have a major consequence for infections, but it might do something. It might do a little bit, it might help a little bit. It's a little bit better practice than before. Or is it going to be a really big deal? You think if you get people to, you know, do good hand hygiene, that is a fundamental key point in infection prevention, crosses a lot of different boundaries, prevents a lot of infectious spread. It's a high impact thing. So are you doing, is it a low impact or high impact? And then is it low effort or high effort? If it's low effort, it's easy to do. It's quick to take care of. If it's high effort, you have to persuade people. Maybe there's a lot of money involved. Maybe there's a lot of political will involved. And so it's going to take a lot of effort on your part to think about it. By going on those two axes, you break things down into 4 boxes. Things that are low impact but high effort, avoid that. Because you're not going to get a lot of good effect out of it. If you have to do it, you have to do it. If it's important, you know, for somebody that it feels that they need to get it done, then that's fine. But if it's a low impact and high effort, you're going to spend a lot of energy on something that isn't going to get you very far. If it is low impact and low effort, those are easy wins, but they also don't get you very far. So there's things that you can do that maybe you say, I'll just do it because it's simple to do, it's straightforward, but it's not going to have a huge effect. But I've got a day to do it, we'll do it. Those are things to do to fill in the gaps. Then there's the high impact stuff. If it's high impact and it's low effort, you want to do that first because you're going to have a big impact on people and it will be easy to get done. So those are the golden tickets. Those are the ones you focus on. High impact, low effort. And then there's high impact and high effort. And I call those my long-term projects. Some people say give up on those because they're pie in the sky. Some of them are really hard and you may never get there. But if they're high effort, but they have a big impact, they're probably worth putting effort into to see if you can move them along. And eventually some of them will become low effort because you'll get political buy-in or money will come your way, or you'll have a new person join the staff who happens to have that expertise and it's a passion for them. So it's going to be easy to implement now. So if you break everything down by that, by impact and by effort, you can start to choose among your hundreds of different infection prevention projects that you want to achieve. And over the years, if you do this kind of every year as you make your plan, you'll slowly trickle down on the projects that you have on your list, and you'll come up with more nuanced, more directed projects as you go along once you take care of the big things. And with that, I will stop there and turn it over to Karen.
Thank you, Dr. Carlson, for sharing those higher level viewpoints and perspectives. And I want to again congratulate the UIOs for how far you've come in implementing the knowledge that you've gained from each of these sessions, where we have talked about highlights like the IPC program basics on types of transmission and source control, looking at preferred methods in hand hygiene, such as the alcohol-based hand rub, the one and only campaign with multi-dose vaccination vials, and bringing it all together, the multi-layered approach with vaccinations, physical distancing, hand hygiene, universal masking, PPE selection, and improved building ventilation. And so with the high impact systems approach that Dr. Carlson was talking about, you have those tools in place. With the knowledge that you have gained, you can reach out to not just the clinical staff being involved in the team approach, but environmentalists, like with the building engineer and facility management perspectives, incorporating that into your overall risk management plan, such that the projects that you have proposed here, and we will soon hear about their progress, that it's integrating those same links that we've listed in each of the domains that the gap assessment had, where there was a request for bloodborne pathogen exposure and control plans with point of care devices and reuse, reprocessing of devices, that you have those same links in place for staff training and competency assessments, the updates of clinic protocols and guidelines, and accreditation efforts from inputs that Approa has included here, and another plugin for her training links as well. So those tools are here, and we're really excited in coming full circle to hear what the UIO champions and fellows have learned all along the way, where they are in terms of their programs and how they are building upon integrating this knowledge gain. What are those next steps in their projects facilitating the QI and accreditation efforts? So I'm really excited to hear that in just a few moments. I did want to just address Johnny's questions very quickly regarding the tool for each of the UIOs. And so we have a toolkit that we are devising specific to the request for training that was found in the gap assessments per UIO champion, but privately, individually, we would review that such that our recommendations would be very tailored, and any additional questions or clarification that the UIO might have can be addressed specifically with the team here. So I just wanted to answer that question. And then just to mention, again, the specific link for Approa's trainings are listed in the chat box. But I'll pause for any specific questions from the audience members. Thank you.
Well, if we don't have any questions, I want to thank Karen, Evie, Zepp, and also Dr. Carlson for your commentary, for your training today in the lecture. But we do have our time today, so of course, I know this will be a big one for us with our wrap up with everything. So I will let Karen continue. If there are no questions, again, we'll just go right into the case presentation so we can share some of our assessments. Karen, back to you.
Thank you, Melissa. So in our case presentation here, we will stop the recording so that we can discuss in full